There was a carpet over home plate, so when I swung, my foot didn't turn, but my knee went, and I tore my meniscus and cartilage off my kneecap on that swing. So the torque of the swing and my foot not going with my knee kind of caused my knee to shatter.
For Finn, and just like many young athletes, the goal is get back to that sport, return to play. Often these athletes are looking to play in college. They also might be looking to even have a professional career. So it's really important that they get back to a pre-injury status.
At first, I wasn't aware of the magnitude of the injury, but as the process went on, I realized that I might not be able to play in the spring, and then I realized I definitely wasn't going to be able to play in the spring, and summer came to my mind because recruiting happens in the summer, and my dream was always to play in college. My surgeon was Dr. Ahmad.
When patients come to see me and they're injured, usually they're anxious over a number of things. The first is, are they going to be healthy again? Is their ability to play sports going to be permanently compromised? My job as a sports medicine physician is first to understand the goals of the patient. What are they interested in doing, and what do they want to achieve when they're healthy again? The second part is then making an accurate diagnosis. Once we can accurately diagnose through history, physical examination, and advanced imaging studies, we create a diagnosis. It's around the diagnosis that we deliver the treatment that will get them healthy again. Some of those are biologic treatments, some of those are rehab treatments. Sometimes it's minimally invasive surgery that allows them to recover with the least amount of complication risk and with the best chance of having a full recovery.
So what he did was he took cartilage from a donor and they put it in my knee, and that was like a long surgery, like 4 hours long. So the recovery time was long. It was like 3 weeks where I was immobile, and I went back for my follow-up, and that's when he recommended Scerbo. He basically just told me that they were the best around.
Finn arrived at Scerbo Physical Therapy because we specialize in post-operative rehabilitation, especially rehabilitation for athletes. So in this case, Finn would like to get back to playing baseball at a high level. And I think it was an obvious choice for Finn that our philosophy met with his, and we would be a good match.
It was very reassuring. He was very confident that we would get me back by summer. We did a couple drills, and he told me that he would definitely work as hard as I'm working to help me play this summer. And from that moment on, I knew that I was very confident that he would help me play in the summer.
When we first see a patient, we take them to our evaluation room. We did a full evaluation on him, which goes from his range of motion to his strength, to his gait, his walking pattern. Unfortunately, Finn was very limited post-surgery, but this is kind of what we expect with a surgery as severe as Finn's.
Our philosophy is simple. We basically treat every patient as an individual, and we treat them the way we would want to be treated or our family members would want to be treated. And it's again, very important that we establish our goals together, and that way we can help them achieve them.
The first phase of our treatment plan was to minimize his pain and swelling. After that, most important was to restore his full range of motion as tolerated. And then after that, it would be to work on his stability, and finally, the strength that would come in time.
It was a great experience. They helped me a lot. Unlike most physical therapists, he really cared, and we texted and stuff, making sure I was doing okay. It wasn't just while I was in here he would care about me. It was kind of just the whole process while I was at home. He'd give me drills to do in here. We'd always follow up, so it was definitely a great experience.
Finn did a fantastic job in his recovery. Within the first month or so, he had full range of motion restored, and he was walking without his brace and his crutches. From there, his stability came back in another month or two, and then finally his strength came back in relatively another month, which exceeded his surgeon's expectations at that point.
I ended up being able to play in late June as opposed to August, so the recovery time, thanks to the physical therapy, was much quicker than it was anticipated to be.
Every patient, every athlete is different, and sometimes those goals can be achieved sooner, and sometimes they take a little bit more time. But ultimately, our goal is to make sure that they are safe and that they can return to that sport, and we will do whatever we have to do to get them to that point.
I guess since physical therapy is a hard thing to do, especially at the beginning, it's nice to have an atmosphere like everyone in here is it just feels like a family. So I would say that's the best part about Scerbo.
We are the place. We will help you get back to that sport and do everything that we can in our power to make sure that you do so.